Thank you for watching this presentation. This is my disclosure. Non-radiation exposure is always a concern when monitoring scoliosis patients. In light of this, radiation-free ultrasound has been investigated for measuring cup angle. Volume projection image showing the line of spinous process can be used to measure SPA in a way similar to how cup angle is measured. This SPA is expected to reflect the cup angle. The first half of this presentation focused on two large-scale clinical studies we have conducted. The first study, the use of ultrasound for quantitative assessment of spinal deformity in AIS, and the second study is used in scoliosis screening. For the first study, the objectives are to evaluate validity for ultrasound for measuring coronal cup using EOS radiography as the gold standard. This is a prospective study recruiting 952 patients according to these criteria. More than 1,400 curves were matched, showing excellent correlation between ECOP measured by EOS and SPA by ultrasound. Regression predictive equations were developed to predict cup angle, that is PCOP, SPA. Now PCOP minus ECOP was calculated, with clinically acceptable discrepancy of 5 degrees adopted for analysis. As you can see here, for upper spinal curve, majority of cases were in the desirable range of plus or minus 5 degrees. The clinically concerning underestimation of more than 5 degrees was noted in only 6% for ECOPs less than 30 degrees, but 37% for ECOP greater than 30 degrees. Interestingly, similar results were noted for lower spinal curve, in which mild curves with cup angle less than 30 degrees fare better than those with larger curves. For body height and age, correlation was greater with greater height and with higher age group. The second study investigated the use of ultrasound for screening scoliosis. In Hong Kong, if school children are screened positive with 4 bending tests followed by more topography, X-ray will be done. If cup angle is greater than 20 degrees, specialist care will be arranged. The objective of this study was to determine the sensitivity and specificity of ultrasound in identifying school children who require specialist referral, and also to evaluate if the angle of trunk rotation can increase the accuracy of ultrasound assessment. This is a prospective accuracy study recruiting subjects screened positive with 4 bending tests and more topography. Now, ultrasound, EOS whole spine, and the ATR angle of trunk rotation were measured on the same day. 442 school children were recruited, with 17.6% requiring specialist referral. Now, curve-based analysis showed an AUC of 0.749, where when ATR was added, the AUC was raised to 0.854. Patient-based analysis showed a sensitivity of 92.3% and a specificity of 51.6%. Notably, there were 6 false negative cases by ultrasound, with a median cup angle of 25.5 degrees, and 3 subjects have major cup angles of more than 25 degrees but remains being missed by ultrasound. In brief, ultrasound can be useful in scoliosis screening workflow. 42.5% can avoid unnecessary X-ray exposure, but at the expense of having 1.4% or 6 subjects having false negative ultrasound results. These two fairly large-scale ultrasound studies showed strong evidence of potential usefulness of ultrasound. However, before widespread clinical applications, the accuracy of ultrasound must be enhanced, example with 3D assessment functionality, so that false negative cases can be prevented. In addition, more data should be available for immature female subjects, and longitudinal studies to investigate the use of ultrasound for prognosticating curve progression should be conducted. Certainly, very promising results will be obtained with artificial intelligence and other innovative studies to be updated by Professor Elvis Choi and Professor Y.B. Cheng and other speakers. Thank you for your attention, and I will hand over the platform to my partner speaker, Elvis. Thank you.